Hi everyone, I'm Sean Malott with the Central Florida Development Council, and today I'm joined by Carlos Carrasco with Orlando Health. Carlos serves as president of Orlando Health Watson Clinic Lakeland Highlands Hospital, overseeing strategic development and operations in Polk County, including plans for a future hospital and freestanding ER in Lakeland. He also leads efforts to expand advanced clinical services in the region. With over 25 years at Orlando Health, Carlos has held key leadership roles, including president of Orlando Health Jewett Orthopedic Institute, home to Florida's first dedicated orthopedic hospital, and COO of Orlando Health Orlando Regional Medical Center. He holds a bachelor's degree in occupational therapy from the Medical University of South Carolina and an MBA from Webster University. Carlos, welcome, and thanks for joining us today.
Thanks, Sean.
So to get things started, would you mind telling us about Orlando Health and its mission?
Sure. So let me tell you a little bit about Orlando Health to start off with. We've been around for over a century. Started with one hospital in Orlando, have grown our not-for-profit health system. Now we have over 48 hospitals and emergency rooms. We serve patients across Florida, Puerto Rico, and Alabama, across 105 specialties. We attract patients from all over the state, region, and nation. And our mission has remained focused, and it is to improve the health and quality of life of the individuals and communities we serve. And that's what we're doing here in Polk County, and excited to open the new hospital.
Yeah, well, it's definitely exciting times. You know, things are definitely under development with the new hospital. So how did you get started in healthcare?
Well, it was a minute ago. I started as an occupational therapist. I was a student at Orlando Health in 1994.
Okay.
Went on to I was fortunate enough to get a job at the trauma center, worked there. Went through.
And which location was that?
That was at Orlando Regional Medical Center.
Okay.
In downtown Orlando. And I was fortunate to have opportunities to move into management. Had some responsibilities within rehab and within some of our skilled nursing facilities. And then did a couple of years of strategy, about 5 years of corporate strategy work. Worked a little bit in telemedicine, a little bit in strategic planning, and then was given the opportunity to serve as the chief operating officer at ORMC. I served there for about 7 or 8 years, and really learned a lot and got to work with an exceptional team that I learned a ton from, and was given the opportunity to open our new orthopedic hospital, which was my last role prior to this in Orlando. It was a 75-bed, 22 operating room platform specifically for orthopedics, the Orlando Health Jewett Orthopedic Institute. And again, was fortunate enough to work with an amazing group of people, remarkable group of physicians and leaders and team members, and was then asked to consider the opportunity here in Polk, and couldn't be more excited to be able to bring Orlando Health and this new hospital to life here in Polk County.
Yeah, so you've had experience in opening new hospitals before, and so really what inspired Orlando Health to undergo this new facility and operations in Polk County?
So Polk County has been part of our long-term growth plans for a while now. We've spent a lot of time getting to know the community, talking to physicians, community members, understanding what the need was, and then there's just tremendous growth in this community. We wanted to make sure that we were able to serve that population with our high qualities, outcome-based approach to healthcare. Since making the decision, the need's grown. You know, we started off as a 100-bed concept for the hospital, and really scaled it up to 300 beds, which is a significant commitment, and I think demonstrates our belief in the need for services in this community, and the opportunity for us to contribute.
And also a freestanding ER as well. Tell us about that.
Yep, that's right. We have a freestanding emergency room coming up on the north side of town.
So how do you see Orlando Health facilities kind of standing out from other hospitals in the region?
Well, I think one of the things that's a great opportunity for us is we have an amazing physician partner. We've got the Watson Clinic, and partnering with them to provide physician services within the hospital with a well-established group that has a great reputation in this community. I think that's that's a great distinction for us. It's also a large facility. We're going to have 300 beds. We'll have almost 70 emergency department bays to start off with, 11 operating rooms expanding to 13, 8 labor and delivery suites, 2 C-section rooms, 4 cath and procedural labs, a 12-bed neonatal ICU. So I think the short version is I think we've got an opportunity to have a great quality, great experience with the opportunity we have with a physician partner
Right.
that we're working with, but also a very capable facility that demonstrates a big commitment to the community.
Yeah, I mean, Watson's a very respected name and again, network within Polk County. So to have a partner like that by your side, I think is really quality.
And then we've got the advantage of being part of a large system and being able to connect back. We want to be able to bring services here, but we also want to lean on the not only the expertise that we have from Watson, but also the expertise we have from our institutes and the programs that we have across Orlando Health, and really learn from them and bring that here to Polk County. So it's really exciting.
Yeah, no, that's very good. So what kind of impact do you see from an economic and employment perspective? What does that look like for the hospital?
So Orlando Health's a fairly large employer. We're the 4th largest in Central Florida, 2nd largest health system in Florida. We're in the process now of hiring over 1,000 team members.
1,000.
Yeah, so we'll be
That's
bringing.
impressive.
It's over the next 6 or 7 months.
Yeah. And do you see how many is that all at the hospital?
Yes.
Okay. Wow, that's
Yes.
impressive.
Yeah. So it's we've got to get we've got to make sure that we've got the right leaders in place. Obviously, we're working with Watson to bring on the physician talent that we would need, but then we're going to need across all disciplines, both clinical and non-clinical, nursing, allied health, support services. We want to make sure that we're not just bringing on the number of people, but the right people with the right commitment to providing awesome healthcare.
Yeah, and you're developing a campus.
We are.
And so you have probably employment at all levels. Again,
Sure.
it's facilities maintenance, I'm sure grounds, like all the different aspects of having a big campus type setting. So
Absolutely. Yeah. I mean, we've got hospitals have a pretty complex
right.
energy plant and facilities maintenance, and then they're even beyond the hospital. Our colleagues at the clinic are building an 80,000 foot building and a 6-room surgery center. So it's more than just a single hospital, but I think it's going to be a really cool campus when it all comes together.
Yeah, I think a lot of times the emphasis is on the doctors and the nursing staff and operations, but really, yeah, it's a big operation to just have that facility available for those people to be successful. And what we've seen in Polk County is really the health sector and health sciences in general is really one of the highest paid kind of occupations or
Sure.
from a target industry perspective. It's healthcare, life sciences. It's definitely an area that we want to see more growth in, and having the healthcare facilities within our community is really important for quality of life, but also just from an employment perspective and how that economic impact kind of ripples into every other aspect, because the physicians that you have working within that facility and the operational staff that's there out eating at local restaurants, they're going to the dry cleaners, whatever it is, right? All these different services that are associated with that. The indirect economic impact of having 1,000 people working is tremendous. I don't know if you've done that study. We've got tools to do that study, but it would be massive, frankly, and it's impressive. So we appreciate that investment into Polk County.
We're grateful for the opportunity, and I think. Our goal is to be a positive differentiator that really brings not only people to work at the hospital community, but makes it a better place to live and work and better for people inside and outside the hospital.
How is Orlando Health partnering with local organizations?
So we've been in the community for a couple of years now. For the rare folks that don't know Don Willis in the county, they probably will eventually.
Everyone knows Don.
Everyone knows Don. So we've got her out.
That's
in the
a great
community.
hire. That's a great hire.
Thank you. Always hire people that are better than you.
I've totally agree.
I've built a career on it. So we've been involved in leadership and volunteer roles for years in the county, really trying to make sure that, and it's more than just being a part of it, but that's how you hear, that's how you listen, that's how you understand the needs, that's how you identify, the best way to be a part of the community through the connections you have, the relationships you build, and the folks that you talk to, and it just really helps us get to know who Polk County is,
right,
and be a better part of the community.
Right. So I've heard a little bit about how you're partnering with even for the local school system from a nursing side of things. Are you able to share a little bit about that with us today?
So we're supporting the Polk County Schools Medical Academy. We recently, one of our docs from the Watson Clinic, Dr. Gregory, one of the urgent care docs, came out and talked about heat safety tips going into fall sports, which is important to keep people well and on the field and still playing. We haven't stopped there. We're working with local colleges to provide advanced educational opportunities. Polk State is part of our preferred education program now. Allows our team members to expand their education and stay within Polk County, which is really important to us and to our teams. And we really encourage all of our team members to be involved in the community. We're always looking for ways to connect back, and Don provides us with tons of opportunities. Usually, sometimes more than we can keep up with. But it's a first world problems.
Yeah,
and we're it's a core part of who we are is wanting to contribute and really be connected to the communities we serve. It's in our mission.
Yeah, well, that's so important, and the thing that we hear from our higher ed institutions is that, especially the ones that are in medical programs or nursing and whatnot, is having the clinical opportunities for their students close by, again, is helpful for them to be able to grow their programs. There's a need out there, but they have to have that pipeline to be able to help, from a training perspective too. So it sounds like you're creating that.
And we'll continue to grow into that.
Right.
As we bring the hospital
You need
live.
to be open first.
Yeah, it helps to be open. It's hard to have a clinical experience without it. But my own personal journey, that's how I started here.
Okay.
And that's how our chief operating officer, Vicki, that's how she started here. And, it's part of, I think it's part of the fabric of who we are. And the other part of it is for me personally, I was never more on my toes than when I had a student with me, because they always wanted to know why. Right. And I think it makes us better. I think providing those opportunities for those young, nursing and allied health professionals to learn it's an honor, not a burden.
Great. Okay. So let's talk about some things that are happening from from an industry perspective. Really AI is transforming many industries out there. How do you see AI, affecting healthcare? And again, this doesn't have to be a positional statement by the organization, but how are you seeing the impact? It's impacting everything right now. How is it impacting healthcare?
It's kind of a broad question. I think where I see it in a broad sense is it's another tool that we have to enable our clinicians to more efficiently or more effectively take care of patients. But in the end, it's still a tool that the clinician has. We've got some examples where we're working with some of the universities back UCF in Orlando to work on technology to improve efficiency of flow in the operating room. Our Digestive Health Institute uses some AI tools to help diagnose. Some example from here at Lakeland, we'll have our MRIs will have AI algorithm that allows them to scan faster and essentially get a more accurate picture in less time. Which, if you've ever had an MRI, it's a nice thing to not have to sit in that tube too long.
Definitely.
So.
Yeah, no, that's very true. Yeah, and I think about like the medical knowledge. It's wonderful to have it all in your brain, but if you can have a little companion with you at all times as well, that's helpful. That's helpful in every industry, not just probably in the medical industry. So beyond AI, are there other trends or innovations that you see kind of shaping the future of healthcare?
Sure. I mean, it's probably, to a lot of people, it's probably a little less glamorous than artificial intelligence, but electronic records, the ability to communicate across the record.
Sure.
The communicating from the outpatient to inpatient environment, not having to repeat testing. Again,
absolutely,
with
that's
our
key. Sure.
With our affiliation with the Watson Clinic,
okay,
we're both on Epic.
Okay.
That allows us to share information in a really seamless way,
okay,
and not repeat some of the testing that is already done, but also understand the broader picture of the patient, the story of the patient, from not just what happened in the hospital, but what happened in the outpatient environment as well. I think it's an incredibly powerful tool to make it easier for patients, make it easier for clinicians, and allow folks to really focus on the hard part of the job, which is how do you focusing on taking care of the patient instead of trying to figure out how to fetch all the data that you need to have the best answer.
And that's a stressful environment for that patient, right?
Sure.
It's something that you can, the more you can have that information at your fingertips to be able to be there for the patient. I'm sure every patient would love to see that go seamlessly.
Yeah, I'm really excited, and we're lucky to have with our affiliation with the clinic,
right?
Folks that understood the commitment and took on the challenge of bringing a really sophisticated electronic record to life in an outpatient environment, and it's just a great match for us. It's another one of those examples where it's just I think we're really laying a great foundation, even beyond what the facility is for this hospital to open up. We're also other technologies. We live in the world of storms, so it's resiliency of buildings and the investment that we're making in infrastructure to make sure we've got more than just a secure building envelope, but a reliable infrastructure to keep all of the work going in the hospital, because healthcare doesn't stop no matter what.
Definitely,
we still got to be able to do our jobs, and we're fortunate.
Hardened facility is key.
Yeah, and so we're fortunate to have I think a really state-of-the-art building from a resiliency standpoint.
Okay, excellent. So, what advice would you give to a young person who's looking to pursue a health career in healthcare or even healthcare administration or leadership? But that could be kind of all directions there.
Yeah, I think the first step is understanding your sense of purpose and why. Why do you want to do it, and finding something that you're passionate about. I guess after 30 years of being in healthcare, you realize you got to find that thing that you love, that thing that you're passionate about, that you wake up and you can't wait to do. And I know that's a little corny, because you got to be practical about what you do for a living, but it sure is a lot easier when you enjoy the work. And then finding which path is the best for you. You can start as early as the medical academies in the high school, or later as you go through college, or even as a second career. There's clinical paths, there's non-clinical paths we talked about before. There's a lot of diversity in healthcare. I think we see the visible roles that are apparent to us, but there's also other roles that are either more behind the scenes or more supportive, and there's need for all of them across a wide range of healthcare environments. It's a lot of people think of healthcare as hospitals, but there's ambulatory settings, there's clinic settings, there's a lot of different environments that need talented people that are committed to doing great work for patients. But I think really finding that reason why, if you're interested in healthcare, why do you want to do it, and what is it that draws you to it, and finding that thing that really feeds that
Is it
sense of
helpful to have
purpose.
that clinician background to from a leadership perspective? I know you have it.
I think it's, but it depends on the role. It depends on the job. I think there's sometimes it's helpful. I think that there's sometimes it's helpful for me to have a colleague that doesn't have it, right?
Sure.
Where I've got somebody who's got a different perspective. I think diversity is our friend because it gives us different ideas and gives us a different way of looking at things. If everybody's from the exact same background, you're going to get the exact same thoughts out of everyone.
Sure.
And having a wide range of experience and inputs just makes us better.
Yeah, that's understandable. So looking 5 to 10 years ahead, what do you hope that the people in the community will say about the hospital and the hospital system?
I think when they think about us, what I'm hopeful for is that they've found in our hospital, our system that we're setting up in Polk County, that we're able to deliver expert care close to home, and that we're a part of the community, and that we're providing outstanding care that they're proud of.
Right.
That they're proud that we're part of the community as much as we're proud to be a part of it.
No, that's wonderful, and that's what we hope as well. It's like we really want every organization to be successful in Polk, and definitely thinking about how that how the community will impact is key. So, is there anything else that you would like to share that maybe we haven't talked about today?
I think we talked a lot about the hospital. We talked a lot about the affiliation we have with the clinic. Obviously, we're excited about those things. We've also got our freestanding emergency room coming out of the ground to the north, and I think we're just scratching the surface of what it means for us to be a part of this community. And I think we've covered most of it. Just really looking forward to getting the doors open and starting to take care of some people.
It's part one. Before the hospital, we'll have to do an after down the road as well.
Yeah, give me a couple months. It's going to be pretty busy.
So, and finally, where can our audience learn more about Orlando Health and connect with your team?
Sure. So, we like we said, we open in summer of 2026. So, between now and then, approach us. It's very rare you're going to see one of us without a branded shirt on. We're very proud of where we work, and we're also very open to people. Just stop, ask if you see someone with an Orlando Health shirt on. It's probably one of us, and we're here to answer questions and be engaged. We're members of a lot of the local chambers. We're in the schools. We're supporting Habitat for Humanity. Yeah. We got a really cool race car at City Garage Motorsports. So we're around.
Okay, we didn't talk about that.
Yeah, we're one of the sponsors. We don't actually own it, but we are one of the sponsors of it, and so we're out in the community and receptive to people. I think the best way to learn is don't be afraid to don't be afraid to come up and ask. And then obviously we're going to be on social media.
Okay.
We're going to be talking to you.
Yes.
You're going to see we've got some hard hat tours posted that are going to come.
I look forward to getting inside.
Yeah. So keep an eye on. We've got videos of our tours coming up. Keep an eye out on social and some of our other media outlets, and then just keep up on the website and the local news. But hopefully over time you won't find us hard to find.
No,
we'll be around.
Yeah, excellent. All right. Well, thank you so much for joining us today.
Thanks, Sean.
I definitely enjoyed it, and we'll look forward to touring that facility before too long here.
All right. I appreciate your time.
Thank you, Carlos.
Thanks.